Hi everyone. Today is World Day for Safety and Health at Work Day. So Jules and I thought we'd jump on and have a bit of a chat about the different types of health and safety at work, focusing on the psychosocial hazards that people can come across. Uh, because there's often a focus on the physical side of things. So we're just going to go through some of the different types of psychosocial hazards and give a couple of examples. So over to you.
Yeah. So I wanted to focus on two in particular that generally impact like helping professions because we're social workers, so that's our kind of wheelhouse. So the first one is moral injury. So that's damage to one's conscience or well-being when you perpetrate, witness, or fail to prevent acts that transgress moral beliefs, values, or your own personal ethics. And then there's vicarious trauma, which is also known as secondary traumatic stress or compassion fatigue. And that's usually from exposure to other people's trauma, really, and usually repeated. So in roles where you're often experiencing other people in distress and different events that can all build up. So some of the symptoms of both of those things are usually sort of mental health related, but they can be behavioral, emotional, physical, all of the above. So things like feeling overwhelmed or numb, a little more cynical than usual, irritable, withdrawing socially, having like decreased job satisfaction, sleep issues, increased susceptibility to illness, hypervigilance, intrusive thoughts. So there's like a scale of these things from like just being a bit stressed and overwhelmed to like really having quite an intense impact on your ability to sort of function in your day-to-day life. Yeah, so those are the main ones that I wanted to touch on.
So I think one of the things that I wanted to highlight with that in mind is, in our kind of line of work, often we have these targets and KPIs that we're meant to meet. And one of the things that I hear a lot is, people who are meeting their targets, but not necessarily feeling like they're able to provide the service or do the kind of work that they want to do within their role to provide their clients with what they actually think that they need, because the time that it takes to do that would mean that they wouldn't meet their KPI. So there's this real like push and pull between what the organization's agenda is and what you as a worker want to give to your clients. And then of course, in terms of people reaching out and trying to seek support from management, often because you are meeting the organizational kind of KPIs, targets, and expectations, there's this thing of, well, you're doing a good job. Like, we're not really sure what you're stressing about. You're meeting your targets. And so your need and beliefs about what you should be providing to your client and what you need to actually perform your job in a way that you feel good about kind of gets pushed to the side, which often then leads to things like the moral injury, and also to a degree even the vicarious trauma side of things, because if you have a client that is repeatedly experiencing issues within a system and things like that, and you're powerless to actually help them when you know that there could be more that you could be doing if you just had more time, it also leads to that as well. So it's really important to think about these sorts of things when we talk about work health and safety, rather than just focusing on, and the physical health and safety is really important as well, but because it is visible, I feel like it's easier to show people when something is physically unsafe, whereas when you're struggling within yourself mentally or psychologically because of the constraints that are being put around you, it can be a lot harder to actually seek that support and get the buy-in that you need to have your actual needs met, which are really, really important for, work satisfaction and just your general overall health, because we give so much in these helping professions. Yeah. So, yeah.
And that's why things like supervision and reflective practice are so important, and like peer support if you've got colleagues that you can speak to as well. If you're not getting supervision or you're not sure what the supervision requirements are, you can look up your particular professional body that can advise you on that. And if you're looking for a supervisor, you can see Anna.
Yeah. Also, I just wanted to add, good idea to jump online and have a look at what psychosocial hazards are in the workplace. If you're in a position where you can provide a little bit of education to your workplace, that would be great. But if not, it's really good to know what a good workplace looks like.
Yeah, and what to look out for.
Yeah. All right.
All right.
Bye.